Black women die much more than white women in Louisiana during pregnancy.
And the state is making gains overall, and it's a fight to reduce maternal morbidity, as Sabrina Wilson explores in this Bridging the Great Health Divide report.
Pregnancy can be one of the most joyous times in a woman's life, and Louisiana is making progress in its efforts to help more women have healthy pregnancies.
Very proud to say that when we look at severe maternal morbidity from hemorrhage, we saw a decrease by 35%, specifically 49% for Black birthing persons, and then a reduction in severe maternal morbidity related to hypertension by almost 12%.
That's important because the CDC says about 700 women die each year in the U.S. as a result of pregnancy or delivery complications, and Louisiana shares in the pain. This report, released in 2020 by the state, is based on 2017 maternal death data. That year, 65 verified pregnancy-associated deaths occurred in Louisiana, representing a ratio of 106.7 deaths per 100,000 births. The data also shows that of the 65 deaths, 15 were pregnancy-related. Dr. Veronica Calypsi Bell is medical director for the Louisiana Perinatal Quality Collaborative, as well as the Pregnancy-Associated Mortality Review.
Pregnancy-associated is the big umbrella. That's all of the deaths. And then pregnancy-related are those deaths that occur because of a condition related to the pregnancy.
Dr. Robert Maupin is a professor and chief of the Maternal Fetal Medicine Division at LSU Health New Orleans School of Medicine.
We know that a little bit more than half of all deaths associated with pregnancy occur after the birth and after discharge from the hospital. That can be a very vulnerable period where we need to make sure that our healthcare resources and infrastructure remain on point, that we're able to monitor mothers who are potentially at risk.
In Louisiana, African American women die more often than white women. When it comes to pregnancy-related deaths, 5.6 Black women died for every white woman.
Unfortunately, that is the case nationally as well.
So why is it critical for women to get health care before they become pregnant, especially in Louisiana, where there's a high incidence of hypertension and diabetes?
Once the pregnancy has started, we're already behind the 8 ball. And so those effects of hypertension and diabetes are going to be controlled and mitigated as much as possible.
When we look at maternal deaths, we know that there are a host of different factors that intersect. And we know that there are areas in which the way our healthcare systems are structured that we need to look at improvements. Moms who are diabetic while at work need to be able to navigate monitoring their blood sugars, address nutrition, and take medication. Same thing with high blood pressure.
On Capitol Hill, the Momnibus Act awaits action.
We do support aspects of the Federal Momnibus Act, and in fact, I've been asked to testify for Congress tomorrow for the Committee on Oversight and Reform. They're having a hearing on Black maternal health.
And the state is working with 42 birthing facilities, including hospitals, to improve maternal outcomes. Now, in reducing maternal morbidity in women who experienced hemorrhaging by 35%, the state exceeded its 20% reduction goal. But the hypertension reduction of nearly 12% fell short of the 20% goal.